Now we want to talk about some of the volunteers out there. Our next hero is Dr. Basil Jackson. When the devastating earthquake struck Haiti earlier this year, Dr. Jackson didn't just watch in shock from afar like a lot of people did. He went to Haiti, where the earthquake killed more than 220,000 people, injured 300,000, and displaced more than 1.3 million. By day, Dr. Jackson is a psychiatrist on staff at Community Memorial Hospital. After hours, you might consider him a superhero. Check out this video of a report by NBC News.
For all the tragedy in Haiti, as difficult as it is to look at the pictures, especially those innocent children, imagine the suffering going on there right now. There are stories of great people and acts of kindness, both great and small. Tonight, one such story, a man who answered the call, and he's making a difference by touching a lot of lives in a place where his touch and his professional talents are badly needed. His story tonight from NBC's Mara Schiavocampo.
At the Tenet Medical Trauma Center on Port-au-Prince's airfield, the youngest patient with the oldest doctor. 6-day-old Michael was born during an aftershock and dropped on his head. Now he's recovering with the help of Dr. Basil Jackson, his grateful mother watching nearby.
This is Michael the Archangel.
A 78-year-old volunteer from Milwaukee, Jackson put his life on hold and got on a plane to Haiti to treat the country's most vulnerable earthquake victims.
God decided this baby needed a grandpa.
In this tent, he is grandfather to many.
You a good boy today?
Offering a small bit of comfort along with bandages and bed checks.
I'm an old man with a deep faith, but faith doesn't count unless you do something about it in your behavior and in your actions.
Basil's glue when things need to be put together.
That means treating body and mind.
That's great.
But Dr. Jackson does more than treat physical injuries. He's also one of the few here tending to children's unseen wounds of psychological trauma.
Did you eat today?
This 16-year-old boy is physically fine, but so traumatized he can barely eat and won't or can't speak to anyone.
It appears that everybody and his family gone, as far as we know.
Also a pediatric psychologist, Dr. Jackson knows exactly what to prescribe.
The most therapeutic thing that can be done for him now is staying with him, so that he has somebody with him all the time.
He knows this territory well, having volunteered at disasters all over the world. This one moving him more than most.
It's just amazing. It's life-changing, even for an old guy who doesn't have much life left.
A doctor with a lifetime of experience treating Haiti's young and needy. Mara Schiavocampo, NBC News, Port-au-Prince.
And because of prior commitments to patients, Dr. Jackson could not be here today. Here to accept the award on his behalf is Dr. Dennis Hill, who went with Dr. Jackson on the relief mission to Haiti. Please welcome Dr. Dennis Hill.
I'll attempt to keep my comments short, but there are a number of people that we want to recognize that supported the mission in January and have continued to support us since then. Why would a 78-year-old psychiatrist and a 50-year-old biomedical engineer end up in Haiti? We were called. We didn't have our resumes out. We didn't sign up on any bulletin board. And like most of you that look back on your lives, you are where you are because where God has planted your feet. The crisis in Haiti is far from over. And I want to bring some things to your attention today. Haiti is a nation 1/6 the size of the state of Wisconsin. And imagine all of the people in the metropolitan Milwaukee area left homeless, living in tents. 1.3 million people are still living in those conditions today. When we went there, a number of people pulled all the stops out, and I'd like to recognize those today. Tim Reichert, who's a vice president of operations at Midwest Express, not only enabled us to travel there, but held a 737 in Atlanta, Georgia that night so that we could make a connecting flight. The baggage claim agent, who refunded our $25 per bag at the gate. Cabela's, who provided us with solar panels and all sorts of survival gear. I mean, I could go on and on and on. I'd like to remember particularly two organizations that many of you have affiliations with. Waukesha Memorial Hospital, who has donated to us over 1/2 ton of medical supplies this year, continue to send us materials, and the New Berlin Fire Department, who were given some recognition back then, and I'd like to continue to remember them because of their paramedic support, but also their materials and their ambulances that they gave so graciously. When we went there, there was no electricity. There is no water. There is no sewage system. It's still that way today. It's devastating. And with the cholera and disease cycle having broken out now, something which Basil and I had predicted a number of months ago, we're a little surprised at how late it's blossomed, but this crisis will continue for another 1.5 to 2 years at least. Tens of thousands of people will die. Unfortunately, Basil couldn't be here today, as he had a prior commitment to serve a community in northwestern Wisconsin that needs psychiatric services. That's Basil. And he would like to extend his thanks to all of you for this recognition this morning, and just ask you to remember your charge in health care, to do no harm, to exercise your talents. These are gifted by God to help build up others in unconditional love. And like all these heroes who are here, remain alert to the needs of others and respond when the call does come. Thank you very much.